days.
Gurto remains in the Allegheny County Jail. PXI is also reporting Gurto is expected to be extradited on Friday to Ohio. This year, over 250,000 cases of breast cancer are expected to be diagnosed in women. And as it is common perception that you won't need your first mammogram until the age of 40. It's never too early to get that first exam. This year, thousands of women will be diagnosed with breast cancer under the age of 40. Erie News Now, Brittany Laufer has spent several weeks learning about breast cancer in younger women and shares the stories of two local women and their fight. Brittany.
Well, today is the last day of Breast Cancer Awareness Month, and we wanted to highlight that you're never too young to be diagnosed. UPMC Hammett surgeon Dr. Gregory Engel says being aware of your body, especially at a younger age, can help you stay proactive.
I was first diagnosed in 2003. And I was 35 at the time.
7% of women are diagnosed with breast cancer under the age of 40. Michelle Wagner is one woman part of that devastating statistic. With no family history, her diagnosis was shocking.
At the age of 35, you're always the youngest one in the room.
Her cancer was stage 0 and contained in her left breast. She had 2 unsuccessful lumpectomies that led to a full mastectomy. But she's not alone in her young diagnosis.
Right away, just cascade of worries.
Erie native Melissa Frohmeyer received the news that she had stage 3 breast cancer in 2010. She was only 30 at the time.
I actually found the lump myself, just doing like a check before I went into my OBGYN, just a yearly appointment.
Frohmeyer surgeons told her the cancer could have been there for 2 or 3 years. She had 2 rounds of chemotherapy, a bilateral mastectomy, then 6 more rounds of chemo.
Breast cancer really doesn't recognize any one particular demographic in which to affect.
Dr. Gregory Engel was a surgeon at UPMC Hammett, seeing hundreds of cases each year. He says although it is more uncommon for women to be diagnosed younger, it does happen.
Your greatest risk for getting breast cancer is being female. Your second biggest risk for getting breast cancer is age.
As Michelle got older and that risk became greater, she began experiencing hip pain, which led to her learning the cancer had returned as stage 4 metastatic breast cancer in her hips, spine, and sternum.
Once we heard that I was stage 4, we thought that was it. But now I've learned that stage 4 isn't always necessarily a death sentence.
It's been 7 years since her second diagnosis. She has been on targeted treatment, receiving her drugs every 3 weeks. This treatment goes directly to the cancer cells without going through the whole body, allowing her to bypass the typical challenges of chemotherapy. Unlike Melissa, whose rounds of chemotherapy caused her to lose her hair and receive other long-lasting symptoms, including early menopause. But the Erie mom's biggest struggle came after the chemotherapy, when she wanted to have another child. She was told her chances were slim to none. And after a miscarriage, they conceived another daughter.
We did not expect that to happen or expect that she would be a completely healthy baby, completely healthy pregnancy. It was a blessing for sure.
Both women are advocates for knowing your body because breast cancer can happen to anyone. I have breast cancer on both sides of my family, and at 21 years old, I had a mammogram for what was luckily just a benign mass of dense tissue. But because of my family history, mammograms and clinical exams will begin even younger and become more frequent as I get older.
You have a strong family history that adds into your risk calculation. We usually recommend starting at age 35. If you have a family member that was diagnosed in their 30s, you may want to even consider starting earlier.
Mammograms, 3D mammograms, and sonograms are all used for screening for breast cancer. The problem with mammograms in younger women is their breasts are more dense, making it difficult or impossible to see any masses. Whether you have a high risk or not, Dr. Engel says diet and exercise do help lower your risk of any type of cancer. He also recommends clinical exams and encourages self-exams starting as early as high school, because while breast cancer in young women is rare, it tends to be more aggressive. Self-exams are only needed to be done occasionally to get to know what your normal feels like. So when something does feel different, you know to call your doctor.
Lumps and bumps aren't necessarily a problem unless they're changing.
Melissa said knowing her body and what changed is why she is still here today.
I am a firm believer that saved my life. You have to be your own advocate, I feel like, so especially when you're young.
Helping women through their own battles is now a passion for both women. They share their experiences with a local support group for young women called Linked by Pink.
Everything is going to be different for each individual. You know, I am in a support group of women, and even though there are some of us who have the very same exact diagnosis, our journey has not been the same.
If you do have a concern or notice a change in your breast, Dr. Engel recommends to contact your physician. And for more information on how to connect with Linked by Pink or other resources, visit our website, eeringnewsnow.com.
Obviously, Brittany, a terrific report, by the way. This disease has affected many families, including your own. Tell us about that.
Yeah, so my mother was diagnosed in 2007 with stage 0 cancer. Very fortunate we caught it early on her first mammogram, actually. And she's doing wonderful now, years later. And my aunt on my dad's side of the family unfortunately passed from breast cancer in 2001 after fighting it twice. Recently had another family member, my step-aunt, pass. She had fought breast cancer in her life as well.
And finally, with that information in mind, just how concerned are you moving forward?
I'm definitely more aware than probably most women my age. I'm very open about it and transparent with my doctors. I stay on top of things. I found that lump through a self-exam, so I keep up on those. I check with my doctors, and I'll probably start mammograms as early as 30 years old.
Wow. All right, thank you so much, Brittany. All right, turning to weather now. The